I'm going to talk about the case study about Ben. Ben was admitted to the hospital after he appeared drowsy and intoxicated. He was awake and oriented. His roommate slash friend, Nate, brought him in because he was having trouble waking him up the next morning after he vomited that prior night after drinking less than a six-pack of beers with his roommates. Ben's parents are divorced and he has one sister. He works at a local cannery and he uses marijuana regularly, but his last use was 2 days ago. He lives with his two roommates, one being Nate, and he stated that he's been vomiting once or twice a day for the last 2 to 3 days. He complained of some stomach pain, and nausea, which was released by when he started to drink. Ben has excessive thirst, and he's experienced nocturnal enuresis and doesn't know why. So after looking over Ben's blood work, his blood sugars were super high. So he was given insulin, which was to help lower his blood sugars. Looking at his 24-hour diet recall, he drank over 2 liters of soda. He ate Doritos, McDonald's. He had some fries, Coke, beer nuts, alcohol, and he still ended up vomiting that night because he also had beer. Looking at this, the client was recommended to lose weight based off of that and his BMI. And this is where I feel that nurse practitioner that wrote this assessment was showing weight bias. I believe this and I feel this because it had nothing to do with the reason why the patient came in the first place, and I don't feel he needs it to be recommended to him. I think the patient needs to look over that diet recall with a dietitian and get asked, why he feels the need to drink so much soda or fluids in that matter, and as well as looking at his diet recall, what nutrient dense foods can help with and what less nutrient dense foods, what that can do to your body and your emotions and your feelings. I think it's important to kind of go over all of that, but understand why he's doing the things he's doing, I think is super important to know and observe as a dietitian. According to Alberga 2016, they talked about how negative weight-related attitudes, beliefs, assumptions, and judgments towards individuals who are overweight and obese can cause more trauma than need to be. When the nurse talks and recommends that after assessing that patient, after assessing Ben, she's showing that she's not listening to what he is actually needing in that moment and focusing more on his body image and size and assessing him on that rather than could there be something more serious going on in his GI system with diabetes or with his sugar levels. She's not focusing on that. She's focusing more on, all right, well, how do we get him to become smaller? Or that's why he's feeling the way he's feeling, which I feel is wrong.